Welcome to Kashi Clinical Laboratories webinar on HLA testing and celiac disease. My name is Dr. Corey Edwards. I'm a staff physician here at Kashi as well as adjunct faculty for National University of Natural Medicine, where I teach genetics. Celiac disease is when the body mounts an immune response to gluten, a protein found in wheat. As a part of the immune response, the villi of the small intestine is destroyed, leading to nutrient malabsorption. The average risk of celiac in the Caucasian population is 1 in 100. However, this occurs in females twice as often as it does in males. People are more likely to develop celiac disease if they have a first-degree relative with celiac, if they have Downs, Turner, or Williams syndrome, and individuals who suffer from an autoimmune disease already. A person's genes have also been found to play a part in the development of celiac disease. A 2-decade-long study tracking 1,339 babies who had genetic risk factors for celiac-linked genes found that children with these risk alleles had a 3 times higher rate of disease development in comparison to the general population. Initially, the genetic correlation was thought to be due to an increase in disease recognition, but several more studies showed disease prevalence to be on the rise. A Swedish study of children born in the late 1980s and 90s showed an increase of celiac diagnoses from 1% to 3%. However, the rates did drop down to 2% for births that took place in 1997. In addition, a study performed in the UK showed a full 4-fold increase in the rate of disease cases over the past 2 decades. However, it still appeared that 3/4 of the people with celiac disease remained undiagnosed. Those Brits don't want to give up their afternoon tea with cake and sandwiches, or their chip buddies, which are, I have on good authority, from an English director of development, a delicious sandwich made of deep-fried chunky potato strips with vinegar and salt. Yummy. This graph shows an increase in interest in celiac disease in the recent years. From 2004 to 2014, the prevalence towards the search term gluten increased almost exponentially in Australia, Canada, and the US. For years, the medical community has debated the question of why celiac disease is on the rise. Can this mystery really be unlocked? Researchers began to look into the role of genetics in the development of celiac disease. Genes that encode for the HLA molecules that present antigens in one immune cell to the other represented a major genetic predisposition. However, HLA typing has its advantages and disadvantages. A positive test represents an increased risk and is not diagnostic. However, a negative test is of significant value because rarely does celiac occur in the absence of specific HLA predisposing alleles. The role of genetics in the detection of celiac disease is important. However, it still does not explain the increased prevalence of celiac disease. Several changes in the environment and in the epigenetic expression of certain genes have been suggested to be the cause. Though the suggested list of causative factors is long, research is ongoing in an attempt to find an answer. A key part to understanding celiac disease is knowing how gluten enters the body and the effect an immune response has on the small intestines. As gluten enters the intestinal tract, it is broken down to gliadin and glutins. Gliadin passes through the intestinal lining and is processed by transglutamase, which breaks down gliadin into its corresponding peptides. CD4 helper T cells then recognize gliadin as a foreign invader and organize an immune response targeted to gliadin. This immune response causes destruction of the intestinal villi, aka the innocent bystanders in this senseless war. The small intestines, the part of the body where most of the nutrient malabsorption occurs, becomes compromised, causing symptoms of GI distress, food sensitivities, and nutrient deficiencies. The impact of celiac disease on the patient is far-reaching. Changes can be seen in the proportion of bacteriocides, and E. coli can increase in comparison to the good gut bacteria. Fatty acid production is altered in patients with celiac due to overexpression of the cytokine interleukin 15. Risk of mood disorders is increased due to noted vitamin and mineral deficiencies, as well as an increased chance of developing secondary conditions such as lactose intolerance. Diagnosis of celiac disease can be difficult because over 200 different symptoms have been associated with this condition. Oftentimes, these symptoms are being expressed in children and can be challenging to elucidate during an intake. The symptom picture is often very different in adults and is less likely to be digestive in nature. Another difficulty of diagnosing celiac is that there can be a period of latent and silent celiac disease. In latent celiac disease, patients have the abnormal antibody blood tests for celiac while having a normal intestinal lining. In silent celiac disease, this refers to patients who have elevated celiac antibodies on blood testing and abnormal small bowel mucosal on endoscopy and biopsy, but no outward symptoms, or at least do not appreciate any abnormal symptoms. Diagnosis of celiac disease can be complicated to say the least. The ideal test would allow a practitioner to diagnose a risk of celiac before any damage to the body occurs. Avoiding painful biopsies and blood draws, genetic testing for the HLA markers can indicate an increased or decreased risk of developing this condition. The genes of interest are HLA-DQ-A1 and HLA-DQ-B. Certain alleles associated with these genes infer an increased risk of developing celiac because the antigen-presenting molecule that they encode for is more likely to detect gliadin as an antigen. Determining the risk for a patient using the DQ markers depends on the combination of risk alleles and can vary depending on the genotype. How accurate is HLA genotyping? 90% of patients with both DQB1*02 and DQA1*05 go on to develop celiac disease. Other genotypes can confer an increased risk ranging anywhere from 5 to 10% increase from population average, which is 1%. HLA genotypes associated with an increased risk of celiac disease are listed here in this chart. Antigen-presenting molecules in people with risk alleles preferentially bind gluten-derived peptides, then presenting them to the intestinal CD4 helper T cells. These helper T cells then direct an immune response to gluten in the intestinal lining by stimulating the secretion of cytokines and other components of the immune system. Here is a list of our references. However, I have a little bit more to cover if you hang on for just a minute. So why test? Genetic testing has numerous advantages. Firstly, it is a non-invasive cheek swab. Secondly, it can predict disease before it starts. It costs less than other tests and is specific for celiac. However, one of the largest advantages is that it can increase patient compliance to a gluten-free diet, which can be challenging for most. Testing zonulin, or antibodies targeted to zonulin, can be a great complement to HLA testing. Zonulin is a protein that is synthesized in the intestinal and liver cells. It is involved in the regulation of the permeability of the gaps between the intestinal cells and is released in response to stimuli as a possible defense mechanism. One of the purposes of zonulin is to release water into the lumen, flushing out microorganisms. Consuming foods that are reacting with your immune system, such as gluten, can cause the upregulation of zonulin. This upregulation can indicate intestinal permeability and the uncontrolled flow of intestinal antigens into the bloodstream. Testing of both celiac HLA markers and zonulin may provide helpful information for assessing a patient's risk of gluten intolerance. HLA testing is used to determine a patient's HLA-DQ and DQB genotype. Kashi Laboratories has a quick turnaround time of 5 to 7 business days, and all that's required is that simple cheek swab. If you would like more information or to set up an account, please visit our website at www.kashilab.com. Thank you very much.